Hello, I'm Nick Bansback and I'm a research scientist at Arthritis Research Canada and also an associate professor at the School of Population and Public Health at the University of British Columbia. But I'm here to talk about a project we've recently had funded by the Canadian Initiative for Outcomes in Rheumatology Care, which is a granting division of the Canadian Rheumatology Association. Its title is A Health Economic Evaluation of Mandatory Switching Policy for Biosimilars in Patients with Rheumatoid Arthritis, which is a long title, so let me break it down and explain what we're going to do. The background to this project is about biologic drugs for rheumatoid arthritis. They are very effective treatments, but they cost a lot of money. And this is where the health economics comes in. As an economist, we want to make sure we get the best value for money with our healthcare spending. It's not about rationing, but rather if we can save money and get the same benefit for patients, then we can use the money saved for other treatments and services and actually improve health for all. So one way that we can save money and get the same benefit for patients is through using biosimilars instead of biologics. They are effectively the same, but cheaper. And so the British Columbia government last year required patients with rheumatoid arthritis on a biologic where a biosimilar was available to switch. Now the hope is that this will save British Columbia lots of money and that they can spend the excess money on alternative treatments. But important policy decisions like this do not always work out as you might expect. And while other provinces are thinking of doing the same, some have even started the process, they are looking at what happens in BC. Now, other ongoing projects are going to confirm whether biosimilars really do provide the same benefits and no greater side effects. But in this project, we'll be tracking what actually happens to the costs by examining the data that is collected in BC and looking at whether the policy has saved as much money as hoped, whether there are certain circumstances or situations where we are seeing cost savings or not, so that we can learn how to do this better in BC, across Canada and across the world. So I look forward to updating you with the results in next year. Thanks.